Please welcome our speakers for the next session, Taking It Global, Her Excellency Miss Janice Charette, High Commissioner for Canada in the UK and Great Britain and Northern Ireland, and she's joined by Glen Ridgway, Divisional Director, Global Health, Safety and Environment Centre of Excellence for Jacobs Engineering.
I'll go ahead and start then, if that's okay.
Carry on.
Good afternoon, everybody. Bon après-midi à vous tous. I'm Janice Charette. I'm Canada's High Commissioner to the UK and Northern Ireland, apparently, as it says up there on the screen. I'm here to talk to you today about what I think is really a shared priority between Canada and the United Kingdom in terms of our shared focus on mental health. And I think that the statistics, no doubt you've been hearing about them all day. And so one of the things that I'll just draw to your attention is some of the Canadian-specific context. The most prevalent form of mental illness in Canada, depression and anxiety disorders. They are now more prevalent than physical chronic diseases amongst young Canadians and adults, according to our health surveillance statistics. Almost 4,000 Canadians died by suicide in 2016, and I think unfortunately that number has gone up since then. And we have a particular population, which is our Indigenous peoples, who are particularly vulnerable. They're at greater risk of experiencing either complex mental health issues and comorbidity with physical health issues, particularly those related to problematic substance abuse. When I say that Canada and the UK have seen this as a shared priority, just one initiative I'll mention to you, because both of our governments have been taking action within their countries and also on the international stage. During the World Health Assembly earlier this year in May, Canada, along with the United Kingdom and Australia, launched something called the Alliance for Champions, for Mental Health and Well-Being, which is an alliance of ministers from those countries who really consider this to be a priority, who want to work together. And those ministers met for the first time here in London in the fall to kickstart their work. So it's great to see that kind of partnership and cooperation between Canada and the United Kingdom. I'm going to spend the rest of my time really talking to you, though, about the Canadian experience. And I would say that Canada really sees that the whole topic of workplace mental health as a key pillar of the overall mental health and well-being priority. And so I'm going to take you through kind of four things very quickly today before I run out of time. One of them is an overarching body called the Mental Health Commission of Canada and the role that plays. I'm going to talk to you about two case studies. One I'm most familiar with is what the Government of Canada has been doing as an employer, and it's with respect to our own workplace. And the second case study is a large Canadian employer, a telecommunications company. And then I'll end very briefly with just a couple of words about other things the Government of Canada is doing on workplace mental health. And then, if I have any time left, just 3 or 4 words of conclusion. So I'll start with the Mental Health Commission of Canada. It is an interesting creature. It was formed by government, but as an arm's length body back in 2007. And it has really been designed to help organizations, governments, citizens groups, civil society groups, not-for-profit groups, with the development and dissemination of innovative programs and tools to support the mental health and wellness of Canadians. And so that was only 11 years ago. But I remember very well when the Mental Health Commission was formed. At that time, it was a really big step forward. We'd gone from thinking about mental health as something that we studied as opposed to actually something that we worked on every single day. And the Mental Health Commission was formed to kind of bring resources together, to shine a spotlight on these issues, but also to provide some very practical strategies and tools to be able to deal with this particular set of challenges. And so one of the areas that the Mental Health Commission identified as a priority was workplace mental health. And they had developed an overall mental health strategy for Canada of which mental health in the workplace and mental well-being in the workplace was really identified as a priority. I'm not going to go through in detail what the Mental Health Commission has done, but I'll just mention to you one particular thing that they've done in terms of workplace mental health, and it's available on their website. What they have done is they have brought together something called the National Standard on Psychological Health and Safety in the Workplace. And so they approach this very much the same way you would PPE equipment. You know, if you're in a workplace and you've got to wear gloves, you've got to wear safety boots, you've got to wear a helmet, this is a national standard in terms of how we take care of psychological health and safety in the same way that you would any other kind of health and safety issue in the workplace. And so it's been brought together as really a voluntary guideline that employers can use, along with the tools and resources to support that guideline. And it's really focused on helping organizations to promote employee psychological health and prevent psychological harm due to workplace factors. And it's focused on a range of different audiences, from senior leaders in an organization, HR managers, as well as our OSH, or Occupational Health and Safety Professionals. It was launched in January of 2013, and it has seen uptake really right across the country, and is now being spread internationally and across organizations of all sectors and sizes. It talks about a number of very concrete steps an organization can go through, from how do you build a foundation for workplace well-being and mental health, how to identify opportunities for improvement, set objectives, and develop initiatives, and then actually implement them. I think this is really the first instance back in 2013 where we saw the creation of what I think are very practical tools like mental health first aid training for frontline managers, but also for employees in terms of self-care, out of the Mental Health Commission, which has been spread across the country and made available then to employees. It doesn't tell you how to do it in your workplace. What it says to you is you have to understand the factors that affect your workplace and design a strategy which is custom to what you're experiencing, what your employees are experiencing, and the risk factors in your organization. So let me segue then to Canada's public service, or our civil service in UK parlance, because it's a good application, actually, of exactly that approach. So I think the government has really been very supportive of the efforts that public service leaders have taken to champion workplace mental health, because government recognizes that if we're going to do this for the population as a whole, we have to start with our own workforce. Canada's public service is the largest employer in the country, with the core public service of just under 300,000, plus our armed forces, our national police force on top of that. So in 2016, the government adopted a federal public service workplace mental health strategy. And so this was a strategy that really had three different goals. How could we change the culture within our public service to be respectful to the mental health of all colleagues? Secondly, how could we build the capacity with the tools and resources for employees at all levels? And third, how can we measure and report on outcomes? One of the interesting things I think about this strategy is it was co-developed between... What am I supposed to do? I don't have a PowerPoint. That's not for me. We're all good here. I'm just going to keep talking. I think Glen has one. So as I was saying, one of the interesting aspects of this particular strategy is that it was co-developed between the senior executive ranks of the public service alongside with our public service unions. This was at a point, I will tell you, where we were at a very fractious relationship between the unions and the employer. And we were able to come together and identify workplace mental health as an area of shared priority, where we were willing to put aside some of our more adversarial positions on compensation, workplace conditions, reform to our healthcare plans, and actually focus on an area where we were very much agreed we needed to work together. And senior level leadership from the very most senior ranks of our public service. In our system, the Clerk of the Privy Council. In the UK system would be the Cabinet Secretary. Championed workplace mental health as one of his priorities for the public service. And he then asked all of the deputy heads across of government to actually sign up personally to a pledge which they would pledge on behalf of their organizations to champion workplace mental health within their organizations. We have over 90 deputy heads that have now signed up to this pledge. It's really a first step, I would say, in terms of how we're building for the future. But this strategy allows, again, departments across government to identify and assess workplace hazards that affect what's going on for their own employees, and they have then used this to develop their own strategies. In 2017, each department did a self-assessment of what was going on in their department and developed an action plan to go along with it. Departments have taken a number of different approaches. Some have put in place an ombudsperson model where employees can feel free to raise concerns and seek help when they need it. There's been a portfolio of what I would say are concrete tools and initiatives, and it's all managed by a Center of Expertise on Mental Health in the Workplace, which has a repository which is accessible to managers but also to individual employees. We have a federal informal conflict management system network that allows employees to access that if they're finding that that is one of the challenges and the stresses they're experiencing in their workplace. And it's really around how do we strengthen resiliency and improve interpersonal communication skills. What's been remarkable to me is that individual public servants have chosen to come forward and really display such courage and passion by telling their own stories and by championing workplace mental health themselves. We have a speakers bureau that will go out and talk to employee groups, to talk at town hall meetings, to talk to groups of employees that are getting together to deal with these issues. We've even had a podcast that has been developed by one of these public servants who I think is incredibly brave and such a really positive role model. They say that what gets measured gets done. And so for now 3 years in a row, every executive in the public service, including heads of mission like myself, have included in our performance management agreement a commitment for us to champion mental health and well-being within our workplaces and actually take steps to address and support mental health concerns of our employees. And so part of your performance is assessed on the basis of the degree to which you do that. And we've now moved to an annual employee survey so we can actually have some way of objectively verifying the degree to which our employees think that we're doing a good job about this. And so in the last survey that I saw, 67% of employees said that their department or agency raises awareness of mental health issues. And 81% thought that they could discuss matters affecting their well-being at work with their supervisor. So those are pretty positive numbers in terms of creating that right environment. I'll just speak very briefly about the corporate example I was going to mention to you, and that is a company called Bell Canada. They are one of the largest telecommunications companies. In fact, I think they are the largest telecommunications company in Canada. They're the company every Canadian loves to hate, because they, do mobiles and cable services and so on. But what they found, the CEO in particular, George Cope, found that 2/3 of Canadians don't reach out for mental health or addiction problems in any given year, mainly due to the stigma attached to mental health issues. And that really provoked George to lead Bell Canada on a mission to put workplace mental health and the mental health and well-being of their employees top of their talent and human resource agenda. They've taken a twofold approach. They've done similar things within their organization that I talked about in terms of creating an environment for people to feel comfortable to come forward with these issues. They've trained 10,000 employees in psychological health and safety. They've doubled their benefits available to employees who require access to psychological or social work supports. But the other thing that they've done is they've championed an initiative called Bell Let's Talk. And so in terms of how do you reduce stigma and how do you get people talking about these things, they have a fundraising campaign where one day a year they contribute 5 cents for every call, text, or tweet mentioning mental health and their campaign slogan of Bell Let's Talk. And that in the first year, they raised $3.3 million. That was in 2011. They've now raised $93.4 million for mental health, and that's gone into a variety of mental health supports, from frontline services to research. And I think it's really tremendous in terms of what it's done as a role model for other companies. Last point I want to make to you is Government of Canada investments and support for mental health. The way Canada is structured, we're a federation. The federal government delivers very little in terms of frontline mental health supports, but the federal government has provided an additional $5 billion over 10 years in targeted funding to provinces and to territories in order to support mental health and substance abuse and use treatment services, with a particular focus on youth, which I'm happy to talk about in the Q&A if we can. Additional resources focused on that Indigenous population that I mentioned, and as well a very targeted initiative to address the systemic barriers and challenges that Black Canadians are facing in terms of mental health challenges in the workplace. We've also done, in the government context, investments to try and improve our surveillance, as well as research. And there's a particular initiative, which if we have time, I'll mention in the Q&A, related to how we're supporting our veterans, and particularly putting in place support for veterans and their families who are sufferers of post-traumatic stress disorder. I have no time left, but let me just say, stigma reduction is working, is my assessment. People are coming forward to seek treatment and support, but the mental health system in Canada is not particularly client-focused. The flow between general practitioners and hospitals and specialized mental health facilities and community organizations is very, very difficult to navigate. We don't give enough support to the families, and we know that mental health, even more so than physical health, is something that affects not just the individual involved, but their families. We have very challenging wait times. We have very significant access issues as a result of stigma going down. People are now presenting, but the systems are overwhelmed. But the very good news that I want to leave you with is this is, I think, a time for us to have hope and optimism about the future, because stigma is being reduced, people are coming forward, and recovery is possible. Thank you very much for your attention. Glen.
Thank you, High Commissioner. I've got some notes, but I'm probably not going to read them. So, let's start. Who am I? Glen Ridgway, Divisional Director. I am Jacob's Global Lead for Mental Health. I could give you all the words in my title, but essentially I like to call myself Director of Happiness. That's my role. I have to put that up. Yeah. So if anybody asks, you've read it. Okay. I'm just going to quickly flick through a few slides. You can read as well as I can. Yeah. Essentially, what I'm trying to say here is, we do a lot of things. There's a lot of us in a lot of places, and we have a pretty good turnover. It's that middle line that is the challenge for us from a global perspective. How do we actually do what we do at a global level? So this is our strategy. Mental Health Matters. Now, we launched Mental Health Matters in June 2016, and it's threefold. It's training and awareness. So it's how do we actually, and this is at every level of the organization. So how do we actually raise the awareness of mental health and mental illness, and provide training to all our staff and our line managers. Building resilience. How do we actually help our staff better deal with the pressures of life and work, and support systems? So how do we support people who are struggling? But not only that, do we have the right policies and procedures in place? So, and that focuses a lot around our employee assistance program, our occupational health, and like I say, having the right policies and procedures in place. Now, the backbone of our strategy is our positive mental health champions. These are people who are trained, and every single one gets the same training, and they were empowered to actually get in and amongst our business and work out how we make this, how we deliver this thing that we're trying to deliver. Now, what is this thing we are trying to deliver? We want to create an environment where everybody can thrive, where everybody can reach their full potential, but actually recognizes that mental illness is a reality. But with the right support, it doesn't need to be a barrier to success. I'm an example of that. Most people will not realize at the moment that I'm in the middle of one of my depressive episodes. I've had 7 depressive episodes in the last 11 years, and I'm smack bang in the middle of one. But with the agreement of my boss, I was able to take last week off. pull myself, develop some coping mechanisms or re-establish some coping mechanisms, get some counseling, get back onto my chemicals, so that I can be here today to do this talk. So that's what we want to try and create, is an environment where that is the norm. So our mental health champions are empowered to get out and about and have these conversations with our people, with our managers, to promote positive mental health, to create that environment. This map blows me away every time I see it. We launched our program in 2016, in June 2016. As of last week, we have almost 1,100 champions trained across the globe. We have 131 people who are trained to deliver the training in a consistent way across the globe, and we have another 1,000+ people who have actually volunteered to get involved. We are in 26 countries, 208 offices, and we are in every single continent except the really cold ones at the top and the bottom. And that's only a matter of time, I'm sure. So whilst that shows our success, it also demonstrates one of the biggest challenges we've got, which is how do we deliver a consistent global message across different national boundaries and across different cultures. And that's where our champions come into their own. I can dictate what the message is. We want to create this environment where everybody can thrive. But I can't tell people how to do it. How we do it in India will be different to how we do it in Canada, will be different to how we do it in the UK. That's just the reality of life. But, and I've heard a lot of these conversations today, that's a challenge, that's difficult, Our experience is, no, it's not. It's a myth that it's actually a challenge to get this done. It's doable, and we'll have a conversation about that later on. So, an example, Canada. We'll take Canada as an example. We have a lot of remote sites in Canada, and most of you will know that remoteness and isolation and being away from family and I think social scaffolding is the phrase I heard earlier on today. That's a risk factor for poor mental health. So one of the first things our Canada team did was to try and make sure that we had champions in these remote locations, to get in there, to be able to have conversations with people, to make sure that they have access to all the resources that they need to do. In 2017, we bought, I'll use the official word, we merged with a company called CH2M. And as you can imagine, for a new company coming into a smaller company coming into a bigger company, a lot of fear, a lot of anxiety, a lot of change that they're having to go through. And in the last year, we've done a lot of work on integration. But it wasn't until we started to talk about mental health and our mental health matters strategy that we really started to see the levels of engagement. It was the hook that gave them confidence that they were joining a company that really cared about them. So our Canada team have gone into every single office. Canada is the first country where we've got champions in every single office. They have the highest ratio of champions to population, apart from the UK and India. And they've really embraced it, because it's the subject that people understand. Oh, there's a bit of animation there. Now, a couple of other examples. India. The public debate in India is actually, there isn't one around mental health. So they're starting from a position of a lack of awareness. So what that team did, within 3 months of getting the trainers being trained, they had trained 100 champions in India. And they get in and they've started the awareness raising program. For them, that's their starting point. Let's raise awareness of the issues. And they actually, the way they do it is through plays and through skits. And so they get in, they do it. I don't know whether anybody's seen the The drama session. So it's going out there and it's doing those. And they do a lot of that. And that works for India. It might not work here, it might not work elsewhere, but for India it works. And they focus very much on the impact on the wider family, because family is important in India. Chile. Chile's the first place where we translated the information into Spanish. Now, that might not sound too unusual, but we're an American firm and all our training's in English. So, yeah, but Chile, they needed it for engagement purposes to be translated. There's also a law in Chile that every company has to report. Every 2 years, they have to fill in a survey saying what they're doing around mental health. So it's another government that's got involved. And in Poland, the word champion has some very sinister connotations in Poland, so they're ambassadors. They're positive mental health ambassadors. Yeah, and there's a lot of still quite macho taboo around it, so their first challenge is to try and challenge some of that taboo. So again, the same consistent message, but delivered by the people on the ground. They work out what needs to be done, and they deliver it. And they're empowered to do that at every level. Oops, there you go, a bit more animation for you. So, 3 top tips. We were told that we had to leave you with top tips, and here are 3 of them. And you'll have seen this throughout the day. First thing is create a plan. Now, the good news is that you're not on your own. There's plenty of information that can help you create that plan. You've got the Thriving at Work report. You've got the psychological standards from Canada. I've read it. It's excellent in terms of setting standards and helping you create a plan and getting some ideas to how you move that forward in your organization. In Australia, there's a charity called Beyond Blue. Really, really good resource. Yeah. And also, I don't know whether you've seen it out there, you've got the Mind Mental Health at Work hub. Yeah, and again, that's a growing hub. Really, really good information. So you're not on your own. So create your plan. Leadership buy-in. Now, we are very lucky in Jacobs. And we've been talking about safety cultural change for about 10, 11 years now. So we've gone through this process where it's not only unacceptable to have an accident, it's actually acceptable to care about your colleagues in the same way you would care about your family and your friends. And to demonstrate that care. So when we started talking about mental health, it was an extension of that cultural change. So we didn't need a lot of persuasion of our executive. When my boss, Katrina Schmolke, went to see our chief executive in early 2016 and pitched the idea, his response was, "What do you need from me to make this happen?" It wasn't a case of, "I support you, go do." He and his executive team have been with us every step of the way. So it was easy for us. However, what you need to do if you're going to get that leadership is find that hook. There's enough information out there, and today's evidence of that, of the benefits of looking after the mental health and well-being of your staff. And if they don't get the business benefit, they don't get the moral argument, use the safety argument. People in poor mental health have more accidents. People in good mental health have less accidents. They make better decisions. So you've got the legal aspect. And talk about how governments across the globe are starting to get involved in this subject. So you can either lead the way or follow, because eventually everybody's going to have to do something. Make it every day, every day. What do I mean by that? We've heard, I don't know whether you were there at the session where Prince William was there, the power of shared stories. Yep. Shared stories work. So what we have is that we have regular, apart from the national events that we support, like Time to Talk Day, Mental Health Week, World Mental Health Day, we've got Are You OK Day in Australia, lots of national events. What we want to do is create an environment where it's just normal, where you walk into an office in Jacobs and it would not be unusual for you to hear a conversation about mental health. And that's happening. It's already happening. But it's everyday stories. It's not just the story of one of our our executive leadership team who talks about the fact he's a single child, he was brought up as an only child because his father took his own life. Yeah, we've got him talking about that, but we've got other people saying the benefits of working flexi time. So it's the full range, and you will hear that all the time. There is regular broadcasts across the organization telling these stories. So it's making it everyday stories every day. So those are my 3 top tips. And I've got 30 seconds to actually tell you about my, if you like, my biggest revelation. It may seem strange, that was a revelation. Mental illness does not discriminate. It's blooming obvious. But what that means is it's the same, mental illness is the same in Australia, in Chile, in Mongolia, in Canada, in Sweden. It doesn't matter where you are. I have been fortunate in traveling the world to deliver this message and to promote this mental health matters. And I'm met with the same level of enthusiasm wherever I go. Mental health matters to everybody. It's not a barrier. How you deliver the message might be different in each country and each culture, but the fundamental message is the same. Everybody has mental health, and mental illness is a reality in every working environment. So let's use it as an opportunity, not a threat. It does not discriminate, and as such, it can help us bring us together. You said it earlier on, bringing the unions together. It was a subject which everybody got behind because it was so important. So let's use that. So don't be worried and threatened by the scary thing about getting it across the globe. Yeah, mental health can bring organizations together. So on that, yeah, I was going to say, this can happen is the tagline for this conference. In Jacobs, this is happening. And I'll leave you on that thought. Thank you. Yes? Okay. You want me to sit down?
Thank you both. It was both brilliant presentations, and I think a very progressive example of government policy, and also of an international company that's rolling this out globally. Very progressive. And as far as Jacobs, Glen's a little bit shy, but it is happening. And in fact, Jacobs is currently a gold employer on the Mind Workplace Wellbeing Index, which is no small feat. And this is a combination of staff actually feeding into surveys as well as an organizational survey. So it's working, and great example. So we don't have a lot of time, but I'm going to take maybe 2 questions. Yeah, we'll go with one for each of you. Glen, you've now visited numerous countries around the globe where Jacobs staff are committing to supporting mental health. What is the one initiative or example of best practice you've come across which has impressed you most across all the countries that you've been to?
I don't think this is the point. There isn't a single silver bullet. In Saudi, at 3 o'clock every day, they have a tannoy system. So they play music, and they ask everybody to get away from their desks and do some calisthenics and whatever. Yeah, so that works for them because they've got a tannoy system. In Chile, when we were doing the presentation, we got hijacked because they'd brought in a dance teacher, and they do that on a weekly basis. And at lunchtime sessions, she comes in and does some dance. And they invited her into our session, so we all had to do, which was great until she started going left foot in, left foot out in Spanish. And I got completely lost there. In the UK, we have, there's constant events going on in terms of, we've had people from the rugby union coming in and having those conversations and all those sorts of things. So it's peer-to-peer conversations. But we have an internal website where we share these ideas, and it all goes in there, and people can have a look and share that. Earlier this year, 15th of November, 15th of January was it Bright Blue Monday? So that was done in Canada, America, the UK, Australia. So yeah, we share these ideas and it all gets out there. So no one thing, yeah, but lots and lots of things. Make it every day, every day.
Thank you, thank you. And High Commissioner, are there any organizations or mental health sort of strategies in Canada that you can name that you think that UK employers could benefit from? And best practice, yeah.
Can I just answer on top of something that Glen said? One of the things that I have which seems kind of blindingly obvious, is that there are oftentimes in organizations a range of supports available for employees. Employee assistance program, there might be health insurance related, there might be the conflict resolution, there may be a number of different supports, but it's amazing as an employee or the family member of an employee, when you start to try to navigate that, like there's no kind of good list, there's no easy to find A to Z. And so a simple pulling together of those resources can be a huge first step for a team to do for itself. So that's just one suggestion. I would say that the go-to place I would recommend right now in Canada is the Mental Health Commission of Canada, because it is a non-governmental arm's length body. It interacts with companies from the largest to the smallest, from government to public sector to private sector to the not-for-profit sector. And they're trying to provide you with kind of how-to as opposed to what to do. And what they include on there is recognizing exactly as you said, that there is no one-size-fits-all, one solution. And so you can go on there and compare yourself to other organizations and see what they're doing and take inspiration from them. And so there's tools and resources and so on. But it really is, I think we're all going through these journeys as employees and employers together. And the circumstances in every workplace are different. The circumstances in my workplace right now are I have about a third of the employees who are living outside their home country and who may be away from friends and family. I have 2/3 who are UK-based, but oftentimes they're the ones who have to travel the furthest just to get to work. And how do we build a united workplace where everybody feels equal and able to contribute to their best? So you have to adapt it really to your own workforce. And so no cookie cutter, but a resource like the Mental Health Commission of Canada, I think, will provide you with some great tools, tips, and motivation.
Great, thank you. And I do know that Paul Farmer and Lord Dennis Stevenson spoke at length with the High Commissioner when putting together the Thriving at Work report. So I would definitely take her advice and have a look at what's happening in Canada. Well, thank you to everyone for coming, and biggest thank you to Glen and to the High Commissioner. Thank you for your time today.